All right. Hi, everyone. My name is Jessica, and I'm the head of customer experience at Prenetics. And so at Prenetics, I oversee two key functions. I oversee the customer success team, otherwise known as CS, which is our support operations. And then I also oversee our consumer insights function. So my role at the company is to collect and glean insights from all the customer feedback we get, and then trying to channel these insights to our product and marketing teams so that they can build products that bring value to our customers. So in the next 20 minutes or so, I'm hoping to share some more about how we're going about building our products at our company. I'm gonna start first by sharing 3 higher level consumer trends that we're very excited about and which inform our product direction. And then I am going to share some more practical tips, hopefully, because I heard that we're supposed to have a lot of startup in the audience. And so hopefully, because as we're building out our team, our products, we also started from kind of like a startup way of working, and I was hoping to share some of our learnings with you guys. But then I also see that a lot of people here are suited up and you all look like you know what you're doing. But hopefully, some of these tips might be useful and we can exchange ideas later as well. So I'm gonna get into it. I am going to first start with talking a little bit more about Prenetics for those of you who don't know who we are. So actually, Prenetics, the name Prenetics actually stands for prevention and genetics. And so we are hoping to help customers get a better understanding of their health profile through their DNA, as well as other test reports, and then also to help people take a more preventative approach to their healthcare. And our company's mission is to bring healthcare closer to people. So here is one product of ours that you might recognize. This is a consumer-facing brand, Circle DNA, which is a direct-to-consumer DNA test. This test gives you a full genetic blueprint, and you can also learn about any potential cancer and disease risks that you might have, as well as other fun stuff such as your ancestry breakdown and any other physical traits that might be genetically linked. And this is another brand that for those of you in Hong Kong, you might have seen this around quite a lot, Project Screen. Project Screen came about as a new business opportunity when COVID hit. So we wanted to leverage our laboratories based in Hong Kong, as well as our expertise in diagnostics to support the Hong Kong government in doing COVID testing around the city. And here are some more key highlights about our company. We are Hong Kong-based, but we do have offices and operations globally as well in the UK, India, South Africa, and some Southeast Asian countries. We've been growing really fast in the recent few years. And recently in May, we listed on NASDAQ. So with more capital, we are very excited to double down on our R&D and then continue to develop on our vision of a health ecosystem. And so I'm gonna dive into how we go about doing that. So I'll share 3 trends. The first trend is that consumers are increasingly engaged in healthy behaviors and prevention. So I think this has been spurred on by the pandemic. The pandemic has kind of served as a moment of realization for many of us here to pay extra attention to and value your own health. And on top of that, we have healthcare systems that are straining. And so there's growing evidence that COVID has indeed accelerated this trend for self-care and prevention. So what are we doing about it? We want to bring the best options for customers to really take control of their own health. So we had Circle DNA, which I highlighted earlier, which might tell you things that you might be at risk for based on your genes. But we all know that on top of genes, environmental factors, lifestyle factors also come into play. So then recently, we've also just launched 2 new products that help to paint a more current picture of your current health status. So these products are Circle Colo Clear and Circle Snapshot. Colo Clear is a stool test that you can do at home and lets you pre-screen for colorectal cancer. Circle Snapshot is also an at-home test that you can do, but it's a blood test, but it's completely painless. And with Snapshot, we're hoping to help people find out about things like their current lipid and cholesterol profile, food sensitivities, hormone and cortisol levels. I think mine are pretty high right now. And also like your level of COVID antibodies as well. So this paints a current picture of your health. So just yesterday, I had a customer interview with someone who just purchased one of our Snapshot food sensitivity tests. This man had just recently recovered from COVID, but he was left with some pretty severe GI tract issues. And so in a scramble to figure out what the problem was, he had booked multiple appointments with his doctors. He had booked an ultrasound, a colonoscopy, and he also bought our Snapshot test. So he ran the test, and we delivered his report to him in 1 day, and he found out that he was actually sensitive to, milk, eggs, and peppers. And so after finding out about that, he actually cut these foods out from his diet, and within 2 days, he claims that all of his most severe symptoms disappeared, and they never came back. And so what really got me excited about that customer interview and the story is that it really illustrates how people are taking that extra step in prevention. And in his own words, he said, "I just wanted to play it safe, and I wanted to cover all my bases." So the next trend that I'm going to share is that there is an increasing appreciation for contactless healthcare. So through the pandemic again, we've seen that certain conveniences and necessities we've really come used to. People today are dialing in through Hop-In, and we generally just expect to be able to access and do everything digitally and remotely. So in healthcare, that's no different. In healthcare, we're seeing an accelerated adoption in telehealth. So there's various research on telehealth that point to favorable consumer perception, strong continued uptake, and a growing investment in the telehealth space, but also in the general digital health space, which then further enables telehealth. There's a McKinsey study done recently that says that telehealth use has increased 38 times from the pre-COVID-19 baseline. And about 40% of these consumers surveyed said that they would expect to continue using telehealth going forward. So what this means for us, we want to be able to meet customers where they are. So we're going to build a telehealth capability. And what's great about having this telehealth capability is that we can then help customers understand the results from the reports from our other products. We can use those results to tailor their treatment plans for them, and everything is contactless, right? So from you collecting your sample to sending it into our lab, getting your report, and then speaking with a healthcare expert to understand your report, all of this can be done remotely. And finally, the third trend that I wanted to share today is a demand for personalized care. So we have a population that's increasingly technologically literate, right? And at the same time, we see that health and wellness are being increasingly digitized. So in fact, venture funding in the digital healthcare space in the US has reached a record-breaking $21 billion last year, versus 14.9 billion in 2020 versus 8 billion in 2019. And what this means is that as more people are using tech to monitor and act on their health, they're also expecting that these digital platforms and tools already know all about them. And when these digital platforms know about them, these customers are expecting that, hey, these tools should be able to offer me the most tailored and individualized solutions, right? So for us, we've already started with products like Circle DNA and Snapshot, which give you a personalized view of what's going on in your body right now. DNA will tell you what drugs you're most sensitive to, what drugs you shouldn't take, what foods you should eat. But then we're further trying to build out more services that can pair well with these insights. So these services could include things like personalized supplements and meal plans or medicine through our e-pharmacy. I didn't highlight that over here, but it could also mean that we could be tailoring hair loss treatment or even fertility and family building care. And so these are some of the products that we have in our pipeline, but that we're planning for in the longer run. Good. So we've touched on the 3 consumer trends in healthcare that we're very excited about and that inform our product strategy. And we're forming this ecosystem around three key pillars, which are prevention, diagnostics, and personalized care. So now I'm going to switch gears. I'm going to switch gears now and go a little bit into sharing some of our key principles that we use on the ground as we build out these products. I think this might resonate with some of you in the audience as you're also building out your own. So the first key principle is that we always have to understand the core problem. And what do I mean by this? So I'll give you an example. Colo Clear is one of our recent products. For Colo Clear, nobody is going to come to you and say, hey, I need to scoop my stool and send it into a lab to test for precancerous lesions. They're not going to tell you that. What they might tell you is, okay, well, I'm at the age, I'm middle-aged right now, and I know that I have to start screening more and more for colorectal cancer risks. But going to the hospital, it takes a lot of time. It takes 1 to 2 days. I have to take leave off of work. It's expensive. And on top of that, colonoscopy is very intrusive. Right? So these are the customer problems. And so we try to understand customer problems and their behaviors to try to come up with a solution. Same thing for Snapshot. Snapshot is a blood test, right? People are scared of needles. They're scared of seeing their own blood. They don't want to schedule time to go into a clinic and then have to go back again to speak with their doctor to understand the results. And that's why we came up with a product that you can collect your blood at home by yourself, get your report in 1 day. A second principle that we always stick to is to get feedback early and regularly. And I think this is quite obvious to everyone. Hey, before you ship out a product, you really should try to get user feedback early. But what I wanted to kind of highlight instead is a challenge that we faced earlier on as a startup. So with startups, you're actually really pressed for time and resources. You don't have big teams to run large-scale surveys. You don't have the money to implement customer experience management programs, or that's some fancy term like that. So you don't have the money to do that. And so in our early stages, we got stuck for a long time on, hey, we have to plan out this huge customer survey program. But instead, what I would suggest for you to do is just look around you, like all your customer support tickets, for example. That's feedback, that's data that you can already start using, putting into themes, categorizing into your key priorities and next product ideas. You can look into your social media comments as well. And so the next third principle that I want to share is that it's very important to build a culture of customer centricity. So another challenge we faced in our earlier days is that as a startup, we're always focused on being very commercially and sales driven, right? Like if you don't make that sale, then you don't have money and then you're just all gonna go down. And what was kind of missing was that balance of having customer empathy or just thinking in our customers' shoes. So what we started to do is then we wanted to try to get our product teams, our sales teams, our engineering teams start thinking like the customer. So some practical tips that we can do or that we did and are keeping on doing is every week we will hold weekly cross-team syncs. And in these weekly syncs, we literally just spoon speed, what did I say? I said spoon speed. I meant spoon feed customer feedback directly into all our product teams, right? So we'll just read them. Customer comments, we'll actually get them to hear customer calls. And so over time, this has really helped our product teams think in their shoes. Another thing that we could do is also to start booking customer interviews and getting the non-customer facing teams to start sitting in and like speaking with the customers. Actually hearing and reading customer words makes the biggest difference. And finally, one last principle is to never bend over backwards for the customer who complains the loudest. In our earlier days, we got really scared sometimes when someone really like sends us a huge loud complaint and they're really angry and we're like, oh, let's just gather all our engineering resources and like, let's build whatever they're asking us to build or fix whatever they're asking us to fix. I'm not saying for us to ignore a customer comment or feedback. We have to absolutely take that in. But when it's just one, you have to remember that it's okay to maybe bucket it for now. You bucket it and then you keep collecting more feedback and then you tally up the frequency. And this is then going to help you manage the tension of not having enough resources and time to then eventually identify the things that do matter the most. And that's it. That brings me to the end and to sum up some of our 4 key principles. Understand the core problem, get your feedback early from whatever sources, build a customer-centric culture, and then don't bend over backwards. Build for the many, not the few. That's it. Thank you so much for your time today.